We're now joined by Dr. Stephen Pomerantz of ProScan Imaging, and we're here to talk about the key injury during week 1 of the preseason. And boy, is it a biggie, because the Detroit Lions wide receiver Jermaine Kearse sustained a wicked injury to that lower left leg. Dr. Pomerantz, once you had a chance to review this one, what are you seeing here?
It looks like, unfortunately, Terrence Brooks, number 25, got knocked into our player, and the ankle is actually folded out, which means one of two things or both have happened. He either fractured the bones of the lower leg, both of them, and based on how they carted him off the field, they probably didn't perforate the skin, for if they did, that would be a real protracted period of healing, versus having an ankle dislocation or both. Odds are that he's sustained both, because you can see the ankle folded outward. So does that make a difference? In terms of the return to play, no, he's out for the season. But in terms of his long-term prognosis, it absolutely does. Even though fractures can be really ugly looking, they generally heal with little consequence. Whereas when you have an ankle dislocation, the long-term prognosis is guarded. The patients have a high risk of arthritis, chronic instability, and usually their ability to cut and turn is hampered. So in this gentleman, it'll make a big difference as to whether he's had an ankle subluxation dislocation along with a bone injury from this sustained on-field insult.
So more information is going to be needed to really give a true look in terms of what the long-term expectations for his return. I guess I can ask you this. What about the stability? Does the bone heal on its own once there's a cast, or will there be some surgery required where maybe you have to put pins to stabilize the area?
It's likely that this one will have pins just based visually on the injury. But if they're pretty well aligned and they have not broken and perforated the skin, then they can simply be casted, put in place, and in a young person of this age, the bones will usually find each other and heal very firmly. You know, we've seen that in basketball players as well, where they sustain tibia and fibular fractures, pretty nasty ones, and they come back as jumping athletes. So it really depends on the degree of angulation and displacement of the fracture.
Is there a good case scenario in terms of his potential to return to play ultimately, maybe after a year, if there's a pin or not? In other words, if it heals on its own, the placement there, is there a better chance of him being able to return?
If it heals on its own, the odds that he'll return to his former level of play, very high. If they put pins or screws in there or rods, the odds of him returning to play still very high. If, on the other hand, he has either one of those and he has sustained an ankle subluxation dislocation event where the ankle joint itself is affected, then the odds of him returning to the same level of play are not so good.
Well, Dr. Pomerantz, we want to thank you for that diagnosis. Really good job of helping us to understand what the potential for Jermaine Kearse to return to play ultimately is long term. We want to thank you for joining us, and that's going to do it for this week. And Dr. Pomerantz from ProScan Imaging giving us the breakdown on the key injury from week 1 of the preseason.